Some good news from Niagara Health. There are still no COVID cases in Niagara's hospitals, but with an uptick in the number of new COVID cases, we wonder how long that can continue to be the case. Joining us now, Derek McNally from Niagara Health. Derek, excellent news. Still no COVID cases in the hospital, and that's been the case now for a few weeks.
That's correct, Mike. I think we're into week 3 now, where we've had no cases admitted to the hospital.
But it is concerning. 21 new cases of COVID yesterday, 40 over a term of about 3 or 4 days. How long can this continue, and what happens if the cases start getting serious and need hospitalization?
From the hospital perspective, we are continuing with our plans to ramp up our volumes both in surgery and procedural care, outpatient ambulatory care, and diagnostic imaging appointments. So we're continuing with that. We obviously are keeping a close eye on what's going on in the community. It's very important that we do that. If we have patients coming into our emergency department or referrals from our family physicians' offices of patients who require admission to hospital, we're ready for that. So we have critical care beds available. We have medicine beds available to take care of COVID positive patients. And we'll just, as we've done since March, keep a daily eye on all of those metrics and statistics that we have to keep our eye on to make sure that we've got the right balance. We don't want to start to cancel things because the community needs that support. But we want to make sure that we've got access for COVID positive patients. So working that balance, making sure we've got our eye on the ball, concerning, yes, that there are increasing numbers of cases in the community, but from the hospital perspective, we're continuing with our business and our ramp up.
Derek, in your role as VP of Clinical Services for Niagara Health, I imagine you must be forced during COVID to strike a delicate balance between what's happening in hospitals now and being prepared for future COVID emergencies.
It's keeping our eye on what's going on within our region and direction and what's going on at the Ontario Health West region, which we are part of, the province, and then, of course, in Canada. So it's just keeping our eye on and managing all of those pieces. But, you know, we have, I've said this before, we have an absolutely phenomenal team of individuals, both in the clinical arena and in the corporate services arena, who keep us all straight in the work that we have to do.
With the current uptick in COVID cases across the region, do you foresee a point where you may end up with so many COVID patients back in the hospitals that you may have to rethink the renewed visitor policy?
That's always going to be on our radar, Mike, for sure. We are always keeping an eye on that. It would be a shame if we did have to cancel visitors coming back in. So we would never make that decision lightly. We would make that decision based on what was going on at all of our sites, because as you know, we have 5 bedded sites in Niagara Health. And so we would be keeping an eye on that. As you know, we've designated St. Catherine's site as the COVID positive site for admitted patients. So, you know, I think that if there's a good thing in this, Mike, it's that we've gone through this now. We've gone through it since March 12th, 13th, whatever that date was. And so we have that experience. So I think that what we would not want to do, unless it was a major catastrophe emergency, would be to shut everything down. We need to keep services going on this side, but on that side, we have to manage the COVID disease and COVID positive patients that are coming in. So again, Mike, it's that balance. I would hate to say that we would have to close to visitors again, because it's so important for the health and well-being of our patients.
Your assessment centers are extremely busy. I understand the other day you had as many as 300 walk-ins. It would really make more sense for people to phone ahead for these assessment centers. What is the situation like in those 3 centers?
On Monday, we had a record number of patients come through our assessment centers. We had a total number of 553 patients come through our assessment centers on Monday, and you've already spoken about the walk-ins. It would be very helpful if people could call ahead and make an appointment. We're actually meeting today to look at, is there another option? Is there something different that we should be doing within the Niagara region to help manage those numbers? Because for us, patient experience is extremely important, and we don't want people coming to any of our sites and having a bad experience. And waiting is not, people don't have patience to wait, and we understand that. But you know, with those large numbers of walk-ins, patients have been waiting, some patients up to 2 hours to get their test done. Whereas if you call and you make an appointment, your appointment is there, you're in and out pretty much around your appointment time, and it saves you a lot of time and energy and frustration.
It's stressful enough to think that you may be suffering from COVID symptoms. Why not ease that stress by phoning ahead and making it more convenient? Thanks again for joining us, Derek McNally. We really appreciate your time.
Always a pleasure. Thanks, Mike.